Well, it's a good question. So I do like to put down trends, and I do like to just put down a marker and say, what's been happening and what's going to happen. How do we understand what's going on? And I have done that, for example, during COVID, and I talked about, what are we going to expect over the next few months within COVID, and then I've done it just sort of at the start of the year. It's a good way to have discussions with people. One of the things that I talk about a lot is Medicare Advantage. So in the U.S., Medicare Advantage is the form of Medicare, which is for people over 65 primarily, that's managed care. So historically, it's been a fee-for-service, do what you want. And more recently, Medicare Advantage has been embraced by both Democrats and Republicans as a way to control costs, give better service, and so on. And one of my predictions is that it was going to be a bit of a backlash against Medicare Advantage this year, because the truth is that it's actually turns to be more expensive than regular Medicare. It doesn't necessarily produce better outcomes, and it gives less choice to the individuals who are members of these plans. It can be highly profitable, but it's not necessarily better. So that has actually started to happen a bit, as there's been questions about whether, is Medicare Advantage really an advantage to have or not? And I'll just highlight another trend, which is related to, two other trends. So one is related to investment. So a lot of what's happened is private equity has gotten interested in the healthcare sector in the U.S. and abroad. And this is, of course, U.S. investors, but also investors from primarily Europe and also Asia to some extent have said, well, this is a highly profitable sector. We don't have this type of phenomenon in our regions. We'll invest in the U.S. Now, the challenge is they may pick off something specific that says, hey, here's a place, a little niche that we can make a lot of money. And the problem is that's antithetical to the overall systemic healthcare reform. So if I'm a hospital, I have to take all comers, whether they have good insurance, bad insurance, no insurance, whether they have congestive heart failure, cancer, or whether they need a knee. But the most profitable patient is going to be that patient that is the orthopedic patient who needs a new knee and has great insurance. So an investor may have something focused on that sector specifically, take that away from the hospital. Now, the investor's making a lot of money. The hospital is now losing money because they were subsidizing the rest of their operation with those patients. And eventually, if that happens enough, you start to have a backlash against those that are doing the investment. So I tell the private equity investors, consider what you're investing in and make sure you have a good story about how it relates to supporting healthcare reform.